Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about peripheral and diabetic neuropathy. 20 million people in the U.S. suffer from diabetic neuropathy, and another 20 million suffer from the other types of peripheral neuropathy. Neuropathy involves damage to nerves that are outside of the brain and spinal cord, and there are three types. Mononeuropathy involves one nerve, such as carpal tunnel syndrome. Polyneuropathy involves several nerves, such as in diabetic neuropathy. And then mononeuritis multiplex involves two or more nerves in different areas of the body, such as something complicated like Lyme disease. What are the causes? There's a lot. The most common is diabetes. It's insane how much diabetes is out there. A lot of people are diabetic or pre-diabetic and just don't know it. Alcohol intake is a close number 2. Chronic kidney issues, liver infections, vitamin deficiencies, autoimmune disease, blood flow issues, heavy metal toxicity, radiation, chemo, various infections, tumors, underactive thyroid, amyloidosis, just to name a few, actually. What are the symptoms? They're going to vary between patients. They may be very mild or they can be disabling. Usually it's both lower extremities or arms involved. Early on you start to get tingling sensation or burning and pins and needles. As it gets moderate to severe, the burning gets worse and it turns into like a searing type pain. At the end stage of neuropathy, you actually lose sensation altogether, so it becomes non-painful. There are other issues that come up. Person can get weakness, instability, dexterity issues. Neuropathy doesn't just affect nerves. Diabetic neuropathy can also affect bladder and cardiac function. So treatments for neuropathy, first and foremost, if it's diabetic, you want to control the blood sugars, or whatever the other inciting issue is. If it's from excess alcohol intake, you want to try and stop drinking and so on and so forth. Medications for relief may include anti-inflammatories and Tylenol. Opiate medications may help along with Neurontin and Lyrica. There's also various prescription pain creams and patches that can help. Additional treatments may include physical therapy, chiropractic treatment. TENS units, such as you see here, they're about the size of an iPod. They have these foam pads through which electrical impulses are emitted through the skin, and that can help change the way the brain perceives pain signals. If there's specific nerve compression, such as in carpal tunnel syndrome, then injections can help. Spinal cord stimulator implant has been revolutionary for neuropathy. It can provide over 80% pain relief, and a new study last year showed 85% improved sensation. Remarkable. And 58% of sensory deficits were reversed completely. It's an outpatient procedure, has a relatively low risk. The procedure involves putting some electrodes around the spinal cord, and then the wires go to a battery pack that sits under the skin and can be recharged from outside the skin. There's also a Delin decompression procedure, which can help decompress some of the nerves for diabetic neuropathy, and it works pretty well as well. What are the outcomes? It's very hard to completely reverse neuropathy, but it can often be controlled. With the variety of non-operative treatments available now, the vast majority of patients are able to achieve a dramatically reduced level of baseline pain. This may include ones that we've discussed here, along with things like maybe laser therapy or a nutritional supplementation regimen as well. All of these things can allow individuals to increase activity and avoid surgery. Surgery may not be indicated for the type of neuropathy that you have, so relieving the symptoms with a lot of these treatments may be in your best interest. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.